Let's talk about delayed cord clamping, everything you need to know. What's up everybody, my name is Jamila. I'm a labor and delivery doula out here in Atlanta, Georgia, and today we're going to be talking all about delayed cord clamping. So first things first, what the hell even is delayed cord clamping? So in previous years, you see it all on TV. As soon as you deliver the baby, the doctors go ahead and clamp and cut the cord right away. So delayed cord clamping is really exactly what it sounds like. It's a moment of time in which you delay the clamping of the cord from the time that you deliver the baby and you deliver the placenta. The timing of how long you want to delay the cord clamping can vary. So let's go ahead and get into some of the pros of delayed cord clamping. So the biggest pro is an increased level of hemoglobin and iron levels within the baby's blood, which is really great because it reduces the risk of the baby's developing anemia. Another pro is it actually can reduce the risk of needing a blood transfusion, and we see exceptionally high rates, specifically delayed cord clamping in premature babies. Another pro is an increased level of oxygen saturation because again, they're receiving the remainder of the blood from the placenta through the umbilical cord. Now with anything we talk about, we want to be honest and talk about the risk. And with delayed cord clamping, there is one main risk that we want to look out for. In some cases, we have seen an increased rate of bilirubin within the blood, which is the main cause of jaundice within babies. Now it is important to note that the risk of developing hyperbilirubin anemia is actually increased the longer you delay the cord clamping. So that brings me to my next point. How long should you delay cord clamping? Delayed cord clamping has lots of positive benefits, so it's become a standard of practice in most hospitals. Generally speaking, OBs and midwives will encourage delayed cord clamping up to about 60 seconds. However, after 60 seconds, there still is a bit of blood left in the umbilical cord, so it really just depends on what is your idea, how much do you want your baby to receive, and that's something that you and your medical provider can discuss. There are some moms who are okay with the 60 seconds, and there are other people who would like for their babies to receive as much blood as can possibly be given back to them. So it really just depends, and that's something that you want to notate prior to you going into labor. So make sure you add it to your birth plan. I think a great sweet spot of time is about that 5-minute mark. Generally speaking, after you deliver the baby, you're going to deliver the placenta within the next 5 minutes. So I think that's an ideal time while you're focusing on trying to deliver the placenta. Your baby is getting all that leftover blood. So what happens if you deny delayed cord clamping? What happens to the leftover blood? One of two things. The first things first, it gets disposed of because it is medical waste. And number two, you can actually donate it. Typically before you're really in the nick of things in labor, you'll have somebody come in and talk to you about donating that cord blood. It's completely optional, but I know you're wondering what the hell are they doing with that blood? Cord blood is actually used for stem cell research. And as we know, stem cell research has done so many great things in the medical field. It's really all about preference. There is no right or wrong answer when it comes to delayed cord clamping. You can delay the cord clamping and allow your baby to get all that extra hemoglobin and iron, or you can go ahead and cut it right away and donate all of that cord blood so that people can get some research done and make more medical advances. Either one is perfectly fine. Like I mentioned before, just be sure to include those plans on your birth plan. Did you do delayed cord clamping or did you donate your cord blood? I would love to know. Leave a comment below. If you have any other questions as it relates to delayed cord clamping or really anything in the labor delivery space, please be sure to comment below. With all that being said, thank you guys so much for watching, and I'll see you next time.